Hi, hey everyone. I am Dr. Aakriti Agrawal, and I'm here to talk to you about the pelvic floor. So I am a physical therapist who specializes in pelvic health. And so when we think about physical therapy, we're thinking about, right, shoulder pain, knee pain, hip pain, right? Think about every other body part except really that pelvis, right? And so I want to talk to you about a group of muscles we don't know that much about. We don't really talk about it. It's kind of even taboo to talk about. So I want to change that today. Have you ever been pregnant and given birth and someone said to you, oh, you're just going to heal on your own. It just takes some time. Or do you leak urine, feces when you cough, sneeze, laugh, or you have this strong urge that you can't control and can't make it to the bathroom in time? Do you have pain with sex or sexual intercourse? People may say that this is just the way of life. It's just normal. I'm here to tell you that it may be common, but that doesn't mean it's normal. What is the pelvic floor? So they are a group of muscles in the bottom of your pelvis. Think of them as a bowl or a hammock. This is a pelvis that has female genitalia, okay? I'm going to take the organs out for a moment. We have the front of our pelvis, the pubic bone. We have our hips side to side, and we have our back, our spine, here. Our pelvic floor muscles are down here in red. They're on both sides, but this side is taken out to show all of our ligamentous support. This is a very loose pelvis. A human pelvis is not this loose. Our pelvic floor muscles, they are from our pubic bone back to our tailbone, so front and back. They go across from our sit bone side to side. They connect to our deep abdominal muscles, our deep hip muscles, and our deep back muscles. So I like to think of these muscles kind of like the floor of your core, right? They aren't just working by themselves. They interact with your abdominal muscles, our hip muscles, and our back muscles. So in physical therapy, we're not just looking at that pelvic floor. We're working how that whole pelvic girdle works together. So I am gonna slice this in half and orient you with our organs. We have our clitoris here. We have our urethra, bladder, vagina, vaginal canal, anus, rectum. So as you can see, these muscles are surrounding our organs. So our pelvic floor muscles, they need to be able to contract so you're not leaking. Urine, feces, both of them. They also need to be able to relax so you can void without straining. They are important in our sexual function because they attach to our clitoris and our erectile tissues for good blood flow, orgasms, arousal. They surround that vaginal opening and that vaginal canal, so tightness anywhere here can lead to pain with any sort of penetration. So sex, it can be like a gynecological speculum, it could be a tampon, a menstrual cup. And so, as well as, especially, it doesn't have to be, but after you give birth, these muscles can be weak too, and you may feel like you have a heaviness sensation or something like falling out. That's what is called prolapse. And so what that is, it can be the uterus, bladder, rectum, or all three. And what it's doing, it's not going to just fall out, right? We have the walls of our pelvic floor here. So what you're feeling is the bladder distending into that vaginal wall anteriorly in the front, or even the rectum pressing into the vaginal wall posteriorly. So that's kind of what you're feeling with that heaviness sensation. A common misconception of pelvic floor and pelvic floor therapy is that we need to do 1,000,000 Kegels to have a functioning pelvic floor. Have you ever been told, oh, just keep doing Kegels when you drive. It's going to be good for you. I want to dispel that myth. So Kegels aren't the end-all be-all when it comes to pelvic floor. Let's say you actually have pain with any like vaginal insertion. Let's say you have difficulty urinating and pooping because you just feel like you have to push a lot. And with that, you actually may need the opposite. You may need to first learn how to lengthen, relax those muscles. Think of a bicep, right? So we don't want our bicep to be in this like really tight position all the time. It needs to be able to relax. It needs to be able to contract. So it needs to do both. Same thing with our pelvic floor. And our pelvic floor, again, remember, it's not just those muscles in the floor. They also connect to the abdominal, hip, and back muscles. So we may actually need to work with all those muscles together. So again, it's not just about Kegels. Another misconception I want to talk about is that it's normal to pee or poop yourself when you cough, sneeze, laugh, jump, or when you have that strong urge. So that's not normal. People say, oh, you've had kids or you're getting older. That's just the way of life. But it doesn't have to be. So what that means is that pelvic floor, it needs to be strong. It needs to get stronger, or they need to be able to coordinate so they can engage when they need to be. Another thing with that is we also have to have really important bladder health. And sometimes we need to retrain our bladder. So I'm going to go back to this pelvic model here. So remember, when we look at that bladder, how these pelvic floor muscles are surrounding them, right? So that bladder also needs to function properly. And so to do that, let's say if you're leaking when you cough, sneeze, laugh, or have the strong urge, you may want to dehydrate yourself. But that's not what you want to do. We still want to have good, healthy fluid intake, even if it seems counterintuitive. When we do also dehydrate ourselves, the bladder gets a little irritated. Let's say you're not drinking enough water. The bladder's like, I'm not filling up nicely. I want to get this all out of me. And so then we go like every 20 minutes even. So that's why we actually want to drink more water. Another important piece of bladder health is to not hover on the toilet when you pee. And so when we go to a really gross public restroom, we want to kind of hover and not sit completely because of all the germs that may be on the toilet. I'm going to challenge you and say try not to do that. So when we hover, we're not able to relax our pelvic floor completely. And so then we're not able to void completely. So I want you to make a toilet paper throne on the seat. So just put as much toilet paper you feel like you need and sit on the toilet. It's gonna help a lot. And then we also want to not just in case pee. And what that means is, let's say you don't have a strong urge to go to the bathroom, but you're going to drive 20 minutes, go to a Target run, whatever, but I'm just going to go pee just in case because I don't want to go there. So I'm going to also challenge you not to do that as well. The reason why is when we are going to the bathroom, when we don't have that urge to pee, where our bladder is probably just a little bit full, and then our bladder senses, she just went to pee. I didn't tell her to pee. That means I must be doing something wrong. So now when I'm just this much full, I'm going to give her the signal to go to the bathroom. And that's why when you just in case pee or you feel like you have to pee a lot, only a little bit comes out, even if you have a strong urge. So even delaying that urge by like 10 minutes, 20 minutes would be a really great thing to do just to make sure you're able to fill up that bladder completely. Another myth I also want to talk about is pain with sex. Have your provider, has someone told you that when you're having pain with sex, they're like, oh, just drink some wine, take some tequila shots, and relax? Please don't do that. There's definitely more things going on. I want to validate that, like, your pain is real. What you're feeling is real. And what you're feeling is those muscles in that pelvic floor are probably pretty tight. And they can be tight maybe closer to the entrance. They can be tighter deeper in. They can be tighter throughout. There's many different things we can do about it. I tell my patients, like, try different positions even with sex. Let's do some breathing exercises. When our pelvic floor is tight and we've been in pain for so long, We can also maybe find tightness in the abdominal muscles, our inner thigh muscles, even our hip muscles. And so we're going to treat all of that, not just the pelvic floor. We tend to hold a lot of trauma and a lot of stress in our body, especially that pelvic floor. So if you feel like you have really tight jaw muscles, you feel like you clench your jaw a lot, your neck muscles are really tight, your shoulders, your pelvic floor is probably tight as well and holding on to a lot of tension. I have people do body scans. Check in with your body every hour and see, where am I holding tightness and stress in my body? Am I clenching my jaw? Can I let that go? Are my shoulders up to my ears? Can I drop them? Am I clenching our abdominal muscles? We're as women, I feel like we're always told to suck in our stomach. Let that belly go, right? Just release that. Am I clenching that pelvic floor? Am I in that tight kegel? Can I do a few deep breaths and let that go? I want you to feel empowered when it comes to your body and your health. If you're having pain, if you are leaking, if you're having any pregnancy, postpartum issues, know that help is there, help is available. I'm here for you. There are tons of amazing pelvic health PTs out there. So get help if you need it, advocate for yourself. And I also want to preface by saying that, everything I'm saying, I hope you learned a lot from this, but I also want to preface by saying that this is not individual medical advice. This is very general advice. So if there is something specific that I said and you're like, this really feels like something I may be struggling with, find a pelvic health PT near you.